So next part is about some intra-articular treatments, especially new treatments, which are the treatments with mesenchymal stem cells and the PRP or platelet-rich plasma. It is important for us to say that there is a disclaimer. Despite these treatments are looking promising, some of the authors and experts in the board are not using them, and there is no consensus in veterinary or human medicine for using this therapy and among their efficacy. This part will be in 4 steps. First, we will deal with the platelet-rich plasma or PRP, then the mesenchymal stem cells. Afterwards, we will see their practical recommendations and a clinical case to illustrate the use of the PRP especially.
Good afternoon, everybody. I just want to start off by thanking Vetoquinol for this fabulous initiative. First of all, I want to apologize for my English. I hope my comments can be understood. Today, I'll be talking to you about plasma rate in platelets regarding the treatment of osteoarthritis in dogs. And we will check the current status of the use of PRP in the treatment of osteoarthritis in human and veterinary medicine. We will evaluate publication and finally try to offer a real vision of the possibilities of this therapy in the daily clinic. Firstly, just a brief introduction of platelets-rich plasma. It is the volume of autologous plasma with platelets concentration that is above baseline, as an autologous blood-derived product obtained after centrifugation. It contains a high number of platelets in a small volume of plasma, and due to its autologous origin, it is considered a safe product. Plasma-rich platelets have been used since the 1990s and nowadays has an important therapeutic application in orthopedics, dentistry, maxillofacial surgery, ophthalmology, and dermatology. Platelets in PRP can be activated by the addition of calcium chloride or other methods to stimulate the release of the granules contents. They contain significant amounts of cytokines and growth factors. Some of the growth factors involved in the chondrogenesis and cartilage regeneration, like platelets-derived growth factors, transforming growth factor, insulin-like growth factor, or fibroblast growth factors. These substances that play an important role in intercellular communication. The main effects of growth factor are the following. They promote cellular migration and proliferation, chemiotaxis, angiogenesis. They also have an anti-inflammatory and bacteriostatic effects. They synthesize multiple autoantiparacrine substances and decisively affect cell survival and even apoptosis. Growth factor also have modulatory and inhibitory effects among them. That is why it is not convenient to concentrate a lot of platelets growth factor, since the balance with the plasma growth factor is lost and the modulation balance can be lost. The tissue regeneration process includes a complex set of biological events controlled by the performance and synergy of a cocktail of growth factors. After an injury, tissues damage occur and large number of intercellular and intracellular pathways are activated and coordinated in order to restore the integrity of the tissues and its homeostasis. We could say one of the effects of the growth factor is that they accelerate the repair process, shortening the recovery period. One of the big problems that exist in this therapy is the number of types of PRP processing. Some with red blood cells, others with leukocytes, different platelets concentrations, and different forms of activation. This makes the results not comparable, and to obtain a high level of scientific evidence becomes complicated. All our investigations have been carried out based on the Anitra protocol which we have validated for the dog. In this protocol, only centrifugation is performed. The platelets concentration is 1.5 to 2.5 baseline, and neither does it contain leukocytes nor red blood cells. This product, plasma-rich growth factor, or prdf, is therefore a type of PRP with these characteristics. It's autologous, pyrogen-free, and simple processing plasma. Its activation is by calcium chloride. This eliminates complications derived from other activation processes. This protocol has been used for treatments in different medical disciplines, like dentistry, orthopedics, or traumatology. Its application in the last decade has extended to many areas of medicine, from oral and maxillofacial surgery to dermatology, cosmetics, sport medicine, and more recently, ophthalmology. We can use the prdf in several types of presentation, depending on the needs of the lesion and the tissue to be treated, such as liquid, clot, or fibrin membrane. In arthrostic processes, the most common method is a liquid intra-articular infiltration. The rest of the presentation are useful in the treatments that you can see in the image. Currently, meta-analysis studies demonstrate the effectiveness of PRP treatments in arthritis. However, the variability in the preparation and application processes means that we need to continue to work more to define the doses, administration, guidelines, and possible therapeutics associations. Especially in veterinary medicine, we have to investigate to optimize the protocol to other species, such as cats or horses, when we don't have product consensus. The application of PRP accelerates the physiological process of regeneration. Regarding actual administration, there is not consensus at this time about the standard regime of administration. Studies on effects have been published after a single injection and after a series of 3 injections, each separated by 15 days. Like other authors in human medicine, we have observed that a single intra-articular application of PRP improves the canine osteoarthritis pathology symptoms until 6 months after treatment. Lately, work has been published recommending the combination of intra-articular injection of PRP with intraosseous injection. It seems that the results are better in severely establishment arthrosis processes. In addition, like other authors, we have verified that the use of PRP in conjunction with fat stem cells increase the clinical effects over time, optimizing therapeutics results. It has been shown that mesenchymal cells in cultures benefit from the addition of prdf to the medium. They achieve greater resistance to oxidative stress and reduce premature cell aging. It also increases the proliferation and differentiation in the group it can see in the image. No better effects have been seen by increase the prdf concentration above 5%. For us, it is an effective therapy in the treatment of articular degenerative disease, as well as in other injuries of the locomotive device. The potential of action is greater when you associate it to other treatments like hyaluronic acid or mesenchymal cells. It is a simpler procedure that we have instituted in our daily routine in the clinic, using many disciplines like orthopedics. It is a reasonable treatment in cost for the owner, with very noticeable effects and with a high degree for customer satisfaction. It must be handled like another tools, but not leaving other concomitant treatments like rehabilitation, nutraceutic treatments, etc.
Another intra-articular treatment is the use of mesenchymal stem cells or stem cells. They are part of the disease-modifying treatments and the regenerative medicine field. The cellular therapy using these mesenchymal stem cells to ease osteoarthritis is a hot topic in humans, dogs, and also horses. In recent clinical trials in those 3 species, results are promising and might pave the way for broader applications in dogs. Indeed, increased prescriptions are recorded right now. First, we will define those stem cells. They are cells capable of self-renewal. They are the body's raw materials. Those cells are capable to give birth to other cells, especially by differentiation in different types of cells. They also are capable of influence the formation of various tissues through the secretion of cytokines and also growth factors. In the specific case of osteoarthritis, we think of using them because they can give birth to cartilage cells, but also to cytokines and growth factors capable to inhibit the process of osteoarthritis, but also the symptoms related to osteoarthritis. Where do these cells come from? There is different type of cells. The embryonic stem cells have the greatest potential. However, they are collected by inside the embryo, so their use are not ethical. So usually we are using adult stem cells, which are collected in adult patients. These are multipotent stem cells. This type of stem cells can produce only some type of cells. For the mesenchymal stem cell, the type of cells that can be obtained by differentiation are especially the adipocytes, the chondrocytes, and the osteocytes. So this type of cell can give birth to fat, cartilage, or bone tissues. For example, you may know also the hematopoietic stem cells, which give birth to blood cells. The properties of the stem cells are depending among their origins, and depending of their origin, there are different capacities of differentiation. Most commonly, the mesenchymal stem cells are harvested from either the adipose tissue or the bone marrow, while adipose tissue stem cells are similar to the bone marrow ones in terms of usefulness in regenerative medicine. They can be isolated in larger numbers, and also their expansion is faster. Despite there is a need for a minimally invasive procedure, surgery is always needed for the harvesting of those cells, which is the difference for bone marrow, because the harvesting is very minimally invasive with only a puncture. In France, especially, cord cells are used in dogs. These are perinatal cells. These cells are harvested after C-section in bitches. They have two main advantages over the other cells. First, the cells are younger than adult ones, so their differentiating potential should be higher than their their collection is without any morbidity or any risk, because it is done after C-section on the explanted umbilical cord. Regarding the cell origin, they can derive either from the diseased patient, which is called autologous, or they can come from an healthy individual of the same species, which is called allogenic. Autologous cell therapy is commonly used in veterinary practice, but the need for surgical collection limits its use first. Also, there is a time which takes from 1 month to several weeks to make the cells isolated and expansion. So it can't be used off the shelf. So allogenic stem cells provide several advantages, which are a lower cost, the fact that they can be used off the shelf, and they can lead to a broader appeal and access for veterinarians. As the stem cells are usually not immunogenic and have a potent immunosuppressive activity, they can be used safely in an allogenic mode. There is some comparison of efficacy comparing the autologous versus the allogenic origin of the stem cells. There is no consensus on whether these or the other type of cells are better. At this time for the use on osteoarthritis. This is not the same in other application of stem cells. In other application, the autologous cells have seemed to be better than the allogenic ones. We will just have a quick look at the protocol leading to the obtention of injectable stem cells. In this example, we will just speak about bone marrow stem cells, but for adipose 1, it's the same protocol. The preparation of the stem cells is quite inconsistent between manufacturers, especially regarding the culture medium and the use of conditionment procedure. But the steps of the process are mainly the same. First, a sample has to be harvested from either adipose or bone marrow. In this example, you can see an aspiration from the iliac crest in a dog, which led to the aspiration of bone marrow. After displacement, the sample will be kept sterile and put for isolation of the stem cells. The isolation and the purification of the stem cells from other not stem cells is done for the mesenchymal stem cells by putting them into plastic, and the mesenchymal stem cell will be attached to the plastic, and with that this property will permit to keep them and to separate them from the other type of cells. After that, there is the need for increasing the number of cells. So there is a process of amplification. This process of amplification is done in a culture medium in order to reach the therapeutic number of cells. At the end, there is a concentration of the cells, and the cells are put in sterile syringe in order to be added and to be used to treat some dogs. In more details, the protocol for the intra-articular injections or the treatment of osteoarthritis using these stem cells. For this type of protocol, again, there is no consistent protocol between studies, and there is no comparison of different type of protocols. Usually, the protocol is just chosen by the authors without many justifications. First, the number of cells to be injected range between studies from 2 to 30 millions of cells. Usually, the number of cells that are used in veterinary patients are between 12 to 50 millions per injection. What is important to understand is once the cells are injected into the articulation, the joint is usually in an inflammation mode. So at this time, a lot of cells will die as soon as the injection is performed and in the hours following the injection. So at the end, usually there is few cells that will be surviving after the injection. The fact that you put too much cell, so there is a cell overdensity, can lead to the apoptosis or the cell necrosis. So you should choose to add sufficient number of cells that that permit that not too much will die, and in the same time, not too much cell, otherwise they will die also. Concerning the route of injection, cells can be delivered directly to the disease site, which is mainly done in studies. Usually the intra-articular treatment is preferred, but in some studies, IV treatments are proposed, especially because there is several joints affected, or mainly also because they are used to add the activity of the intra-articular injection. So in some study, both injections are done, IV and intra-articular. There is no study comparing the difference between intra-articular versus intra-articular plus IV. However, in one study, the intra-articular versus the IV injection was compared for one joint, and the intra-articular was found to be superior. In fact, the stem cells are capable of what we call homing. That is to say that they can go, when they are injected in some points, they can go to the diseased points. They can be called to go there by cytokines in the blood, especially. In one study, indeed, the injection was made in a subcutaneous location at some acupunctural points in dogs, and it was found to be quite efficient in this way. Another thing that is quite important in the protocol is the number of injection. Again, there is no consensual agreement about the number of injection. What is known is that in some cases, one injection would not be efficient. Indeed, in quite 1/3 of the patients, there was no or low efficacy after just one injection. It is also said that to repeat the injection can lead to some efficacy in some dogs. Usually, we don't know exactly the timing when the injection is done. We don't know also the delay between two injections. What has been said by some authors is that the efficacy of one injection can be increased when you repeat after 6 months the therapy, but it was only one study. And what is known from experimental trials also is that there is longer lasting effects that can be obtained after a periodic injection, after repeating some injection every 2 or 3 days at the first step of the injection. But it was all experimental trials, and we think that it can be done in a daily practice in dogs. An important issue when speaking about stem cells is to speak about safety. In all studies, there is no serious effects that have been identified. Among the potential adverse effects observed, most were related to the injection and the intra-articular traumatism after the injection. All of these effects were transient. For example, as you can see, pain at the site of injection was resented. Joint swelling can be expected during the following week after the treatment. Skin allergy was noticed after clipping and after the joint preparation. One must keep in mind and warn the owners that 1/4 of the dogs can be worsened after the injection the following week after the treatment. All the side effects using the IV treatment have been described in other indications than osteoarthritis, especially in horses where they are more pronounced. In case of using the allogenic treatment, we spoke about quite before, but there is studies trying to look at the immunogenicity of these allogenic stem cells, and there was no antibodies that have been identified after the injection of those stem cells, even they were allogenics. So there was also a cross-match that was done in those dogs that was treated by stem cells coming from another dogs, but there was still negative. So we can say that the stem cells are quite non-immunogenic in dogs, or when using them at least intra-articularly. Another important issue is the regulatory requirements. In fact, there is no true requirements that are needed when they are used in dogs. There is some that are coming from the reglementation of the FDA in the United States, especially. There is no true control at this time, but there will be. The legal marketing of stem cells require normally and legally a pre-market evaluation of the safety and the process when using the stem cells. In the studies in dogs, there is only one study when we can have a look at the materials and method and see that in the steps and the process of the stem cells, there was conducted regarding the FDA approved reglementation. There is many prerequisites for the stem cells regarding the processing, the guarantee of the sterile process, the guarantee of the safety using several products of stem cells. What is important to remember when regarding this slide is that this reglementation is coming, and we will just keep that in mind when choosing several projects for one specific dog. So the last issue and the most important one is, are these stem cells and the cell therapy for osteoarthritis efficient? What has been done in dogs regarding the efficiency results? Many studies have been conducted to evaluate the influence of stem cell injection or treatment in order to treat the symptoms related to osteoarthritis, but only experimental studies have been performed to study the true effect of the stem cells and whether they are regenerative or not. There is a main difference between these two type of studies. The first one is just looking around the symptoms related to osteoarthritis, and the other one is looking among the disease, the osteoarthritis, and whether we can treat osteoarthritis, which is a main difference. So remember that this one clinical studies in dogs are only around the symptoms. Some of these studies have demonstrated improvement in these symptoms based on lameness scoring, pain scoring, and also quality of life improvement testing. So using relatively subjective methods, even if some were conducted over a placebo in a blind controlled way. However, there have been immunomodulatory effects that have been proven, especially in the context of choanal cruciate ligament disease in dogs. In addition, in one clinical study in only one dog, the dog was followed arthroscopically after and before an injection of mesenchymal stem cells, and a biopsy was performed in the joints, and it seemed that there was a cartilage regeneration, but it was only one dog, one study, one biopsy. To make a long story short, taken together, the whole clinical studies performed in dogs found that the mesenchymal stem cells treatment can be superior to a placebo, superior to NSAIDs treatments, especially in dogs where NSAIDs are not working. They can be also superior to PRP treatment under certain circumstances. They can relieve pain, lameness in dogs, and there are usually no adverse effects. There are two ways of action for stem cells. One way is the stem cells that can differentiate into the cartilage cells for osteoarthritis. This is one of the goals. It is important to remember that there is no study that has proven that this is working. The other way of working for the stem cells is that they can secrete many growth factors and many cytokines. And we think that this that is working on the symptoms. And the main action of the stem cells is that they can reduce, because of their immunomodulatory effect, the inflammation. And so they can reduce and stop the ongoing disease and the symptoms. Regarding this efficacy, how long does it last? The duration of the improvement is usually observed to last for 3 to 6 months, depending on the studies and depending on the follow-up in those studies. Improvement in pain, lameness, and range of motion was observed from 1 week after the injection to 6 months in most of the studies. However, in 2 of them, the follow-up ranged to 1 year, with an improvement still observed in dog after 1 year. As suggested by several authors, a 6 months follow-up period can be considered as a standard for testing the evolution of a medical or surgical treatment. 6 months is also enough to detect great differences among different strategies to test lameness in dogs, especially. In fact, the dogs in the current studies seem to improve during the first months after the treatment, but this effect has disappeared within a period inferior to 6 months. So usually in the new study dealing with those type of treatments, the follow-up is around 6 months. To conclude, the stem cell therapy are a promising therapeutic tool for osteoarthritis. They can secrete trophic factors, recruit endogenous cells to the damaged lesion, and differentiate maybe into chondrocytes. But this effect is not truly demonstrated in dogs or in experimental studies. They can improve the treatment of osteoarthritis in a global way, because they can be had when some other treatments are not working, especially when NSAIDs are not working. For this reason, they are part of a personalized therapy, a specific treatment for each specific type of cases, each specific dog, each specific moment in this specific dog. And this is one of the reasons, because for the stem cells to be especially popular, because there is a very personalized medicine, and the stem cells are usually modified. They can adapt to each patient. And the main difference between the stem cells and the PRP is that they are used such as a captor, and they can secrete specific molecules to each specific joint, each specific patient, and they lead to the fact that we will have an adaptive response.
I'm going to start with the practical recommendations. According to the old laws, the application of intra-articular PRP in osteoarthritis has become a simple and rapid treatment, minimally invasive, safe, without the need for a surgical room. All complications were minor and corrected within 48 hours. The most common being inflammation, bleeding, and edema. In Spain, this use has been approved by the Spanish Medical Agency and is considered a medicine.
So we try to sum up when and how we can use either the mesenchymal stem cells or the PRP. What is very important for you to understand is that those intra-articular treatments should be used in patients unresponsive to conventional therapies or referred to experienced clinician, maybe in the case of clinical trials. But remember that it's very important that is kept only for unresponsive conventional patient to conventional therapies. I will try to have some decision trees regarding which type of treatment and in which type of patient and at what moment you can do both of the treatments. The first type of patients are patients that are diagnosed quite early in the course of the disease. So many patients that are diagnosed with a disease that can lead to the development of osteoarthritis, such as an OCD, or maybe some type of cranial cruciate ligament disease, especially one study has been conducted in patients where injection was performed on the second stifle. In this specific case, which is case number 1, in case number 1, we recommend that those cases are treated only in referral center in case of clinical trials with experienced clinicians. In these cases, if a surgery or an arthroscopy is performed, stem cells can be had in a joint where there will be a lot of inflammation or where there will be a puncture that is not closed, such as with arthroscopy. For this reason, when you choose to put in case number 1 some stem cells, you should wait 1 month after surgery or arthroscopy. When you choose to do PRP plus or minus hyaluronic acid, which stands for HA, it is possible to do it even if surgery or arthroscopy were performed, and it can be repeated 1 month after that. Another type of cases is the case number 2. It's cases where there is a severe osteoarthritis. These are the cases where the osteoarthritis is not responsive to conventional therapies, especially not to NSAIDs. In those cases, usually there is some joint swelling or several joints affected. So in case number 2, we will deal with the cases first where there is joint swelling, where there is a very important joint swelling, which is quite of a soft swelling or a huge joint. In this case, first, before thinking to some therapy inside these swelling joints, we will have several questions. First, as rest, NSAIDs, and physiotherapy work? If not, okay, you should do joint puncture and say whether the joint has some sepsis ongoing or whether there is only inflammation without infection. In those cases, you can perform intra-articular treatment, but it can be performed if you have only a suspicion of infection. You should postpone any intra-articular treatment in any doubt of infection. For the intra-articular treatment, you can perform first an articular lavage, in some cases steroids before any injection and just wait for 1 month or several weeks, or hyaluronic acid. But in a very swelling inflammatory joint, you never put PRP or MSA because it won't work. So you will lose a lot of money and maybe you can have some adverse effects. So you have to wait several weeks, 2 or 4 weeks after thinking of any treatment. So first, in a swelling joint, you exclude any infection, then you treat the swelling either with steroids inside the joint or articular lavage or both. And after that, you think of any intra-articular treatment. If many joints are affected and many joints have several huge infections, same way, you will just think, is this only osteoarthritis? There is something else ongoing. So you just have a check at the animal and make some joint puncture. If there is several joints, you just have to think about doing some IV treatments because you can do several joint injection in the same time. Then we go to the third case, which is quite the end of the case 2. So it's a case 2 without joint swelling. So in the case in a chronic patient where there is severe osteoarthritis, we grade at the COAST stage 4. It is unresponsive for any treatment, any conventional treatment. In these cases, first, you will choose either to perform a treatment using MSCs or PRP, plus or minus hyaluronic acid. If you choose to do the stem cell therapy, first you do the injection in a sterile way inside the joint. You wait for 2 months. After these 2 months, these 2 months, you just have a look at your dog. Is this working? Is there some improvement? Has there been some adverse effects? Is the owner okay with these treatments? If it's working, you just wait another 6 months to have a recheck. If it's not working, you may consider either to perform a second injection of the mesenchymal stem cells. You remember that sometimes it's working after the second injection, or to change treatment, or to add plus the stem cells, either hyaluronic acid or PRP. After 6 months, if in the first steps you recheck your dog, the dog is okay, you just wait and you see it in another time, maybe 1 year after the treatment. If it's not working, same way, you just think about doing again the stem cells, or doing PRP or another treatment, or doing a combination of MSA plus PRP plus minus hyaluronic acid. It is quite the same if you choose at the first step to do PRP. So you do PRP plus or minus hyaluronic acid. You just have a recheck 2 months after the injection. If it was working, it's okay. You just wait for another 6 months. If it's not working, you may consider do again the PRP or do a combination with MSCs or the hyaluronic acid if you haven't performed the hyaluronic acid at the first time. After the 6 months, same way with the stem cells, you have a recheck. Is it working? If it's not working, just do another PRP or another therapy. So to conclude, what is very important to remember for this type of treatment is that chondral regeneration is the optimal goal, but it should not be the objective of your treatment. This is not usually how it is working. Usually it's only treating the symptoms, so the inflammation. Usually when you propose the intra-articular therapy to an owner, you should say that it will be treating the pain, the lameness, but you should not promise that it will be do a regeneration of the cartilage tissue.
Pain and lameness are often improved using PRP and mesenchymal stem cells, or both.
There are numerous formulations of PRP available. Homogenization is needed in the research field to compare several studies and also to obtain solid conclusions on whether it is working or not.
No standardized protocols are available yet. Referral to experienced clinicians is required.
Indeed, you should report the cases because only few studies are available, and it is the only way we can draw definitive conclusion of their efficacy.
Caution in those advice and this therapy should only be used in patients unresponsive to conventional therapies. So I'm going to start with the clinical case of follow-up. You can see the method to obtain the prdf in clinical case. We get the blood from the vein to jugular with the vacuum systems under sterile conditions in sodium citrate tubes. Then we centrifugate the tubes at 460 degrees for 8 minutes. After this procedure, we extract the plasma curlin, understanding that the upper part, about 60%, is the poor plasma in platelets. So the inferior part, about the 14%, is the red plasma in platelets. We carefully extract from the surface to the depth. First, the plasma pouring platelets of all the tubes. Then, we will get the plasma rate in platelets of all the tubes, taking care to not soak below the line of the white cells. You can see in the video. Then we prepare the sterile injection area, similar to surgery for the infiltration. We activate the plasma rate and growth factor by adding 5% of the volume to the calcium chloride 10%. We try to previously withdraw the volume of synovial fluid so that it doesn't increase the intra-articular pressure. Then we proceed with the application. Application types. Application in a single injection in surgical procedures or arthroscopies. Pre-application in osteoarthritis procedures with a period between injection of 15 to 20 days. Generally, the first application is made in association with hyaluronic acid. In animals that occur with a severe exacerbation of osteoarthritis, with very painful inflamed and hot joints, we first apply a corticosteroid injection. We begin with PRP infiltration 3 weeks later, when the inflammation has been controlled. I present another case of treatment with prdf. It's a 10-year-old Basset Hound dog. History of pain and disability due to osteoarthritis of the knee, as you can see on the X-ray. It is also my dog. She has been infiltrating between 8 or 12 months, depending on the symptoms, for 3 years. Very good results you can see in this female dog. Thank you very much for your attention. I am waiting for your question.